Hi guys, my name's Olivia and this is my patient Lindsay. Today I'm going to be performing the head, ears, eyes, nose, and throat assessment. I've already verified the physician's order, gathered all my supplies, and performed hand hygiene, and I've also explained what's going to happen to Lindsay. So first I'm going to assess her overall appearance. Her skin is pink, warm, and dry. She seems very well nourished. She's dressed appropriately for the season, and her overall mood and affect are great. And her speech and hearing are both intact as well. So first, I'm going to go ahead and assess her level of orientation, or level of consciousness, which is intact. Her orientation, she's oriented ×4, and she makes eye contact with me whenever I ask her to. So first, I'm going to go ahead and check out her cranium, and everything feels great here. There's no bumps or anything that I notice that's out of the ordinary. Her face is symmetrical. Her hair is well nourished. She seems healthy. Nothing's falling out. So now I'm going to go ahead and palpate her temporal artery. Everything's good there. And I'm going to go ahead and feel her temporal mandibular joint, and I'm going to have her open her mouth twice. Good. Range of motion's great there. Everything feels good. And now I'm going to palpate her sinuses. Any pressure? Nope. Good. Alrighty. So next, I'm going to go ahead and look at her eyes. And so at first, I'm going to do the test to test her peripheral vision. So you just tell me whenever you see my fingers, okay?
I can see them.
Okay?
Yep.
Perfect. Alrighty. And then next, I'm going to look at your cornea. Perfect. They're smooth and clear. Perfect. Alrighty. And then next, I'm going to have you just stare straight at me and stare at my finger and only move your eyes, okay? Perfect. Alrighty, so both of those eye assessments were intact. Her peripheral vision is good. She tracks really well. There's no nystagmus present. And so now I'm going to look at her external eye, and everything looks great. There's no swelling, there's no redness, and no jaundice. Her conjunctiva is nice and moist and pink, and it's clear on the eye. Everything looks great. The sclera is nice and white. Her irises are even, colored, and flat all throughout. And everything looks really good. And so now I'm going to test her pupils. So just stare right at me. Perfect. Alrighty, so her pupils are reactive. Just stare right at this as I bring it in. Perfect. Perla is present on Lindsay. And so also, if we were to do the Snellen's test today, since Lindsay does wear glasses and contacts, I would have her keep her glasses on or her contacts in, whichever one she had. I would have her stand 20 feet away and try to read the lowest line possible. And then whatever line she reads the clearest is the number, at the end of it, it's a fraction, and that's what I would record for her. And so next, I'm going to go ahead and take a look at the ears. And so with her ears, I'm going to inspect the outside, and there's no lesions, there's no drainage, the skin is intact. And so I'm going to look at her canal, and everything looks great, nice and clear canal with some wax, which is normal. And her tympanic membrane is pearly gray and translucent. And so I'm going to do the same thing on this other ear. Perfect. Alrighty, so everything looks great there. And so I'm going to have you do, we're going to do a whisper test. So I'm just going to have you plug your ear, and I'm going to whisper, and you tell me if you can hear me. Okay. Alrighty, so Lindsay's hearing is intact. Everything is great. So we're going to go ahead and move on to the nose. And so the nose is symmetrical. There's nothing that I notice that looks off. Her skin looks great. I'm going to have you go ahead and take a breath in. Good. Patent on that side. Good. We're patent on that side. All right, and I'm going to actually take a look in her nose and look at her mucosa and her septum and everything else in there, and everything looks great. Septum is not deviated, pink, moist, and everything is good in there. And so then next, we're going to go ahead and look at your mouth. So if I can have you go, ah, ah. Perfect. The uvula moves up and down like it should. The soft and hard palate function as well. And her teeth are white. Her tongue is flat and even. Can you go ahead and stick out your tongue for me? Perfect. And can you lift up your tongue? The floor of her mouth looks great. It's nice, pink, and moist. And then her inside of her cheeks. Let's look at the inside of your cheeks. Look great. She has no tonsils present. She did get those removed. Perfect. Everything looks great in your mouth. And then last but not least, we're going to go ahead and take a look at your neck. And so with your neck, I'm going to go ahead and palpate your thyroid. Perfect. And then I'm going to kind of deviate your trachea just a little bit. Perfect. Perfect. Just to feel those pulses and to make sure everything's working. Now I'm going to feel the pulses again from this angle. Perfect. And I'm also going to go ahead and feel for your lymph nodes. Any pressure or pain when I felt your lymph nodes felt great. Perfect. And then I'm going to have you, can you rotate your neck like this? Perfect. And your neck's been pretty strong throughout. Your midline, your trachea, and your thyroid, everything looks midline. So that is all. Thank you.